let's talk about ketogenic diet. I'm not gonna make a lot of friends with this diet, but that's fine. I think we know what ketogenic diet is all about. All right. Basically, you're restricting your carbs significantly. Why? Instead of using glucose, you're using ketones as a fuel source. All right. Essentially, the diet comprises of 75% fat. Actually, according to some resource, that can go as high as 95%. Some level of protein and only 2% carbs. All right. There's a strong movement. I don't know if anyone knows Dr. Seifried. I respect the guy. He talks about the metabolic nature of cancer. And he's a strong proponent of the ketogenic diet. Now, one of the things I try to do is I personally need to see research before I can jump on the bandwagon. So basically, I've not seen any randomized controlled studies with ketogenic diet and prostate cancer. So let me repeat, I have not seen any studies with ketogenic and prostate cancer. Now, am I discouraging anyone to do the ketogenic? Absolutely not. Who am I to judge, okay? But I've not seen any research, so I can't endorse it, nor will I vouch for it. Now, I'm going to tell you the reasons why shortly. And by the way, if you're dealing with, if you know a friend who is dealing with melanoma, or they're dealing with thyroid cancer, I would not suggest ketogenic diet. And the reason why, they found that those two cancers can use fat as a fuel source to grow. All right, so just keep that in mind. But in terms of prostate cancer, back to prostate cancer, the reasons why I'm against the ketogenic for prostate cancer, two reasons why. Number one, they found that a Western diet with processed and high-fat foods had a 2.5 times greater risk of dying from prostate cancer and a 67% higher risk of death overall. Basically, that's with a high-fat diet. It's not necessarily a reflection of the ketogenic diet, but remember, in the ketogenic diet, you're using a lot of fat as your fuel source. Keep that in mind. Also, secondly, if a Japanese moves to America, relocates to America, adopts the Western Americanized diet, what happens? Basically, they increase their prostate cancer risk. And one of the themes for that is because you're consuming more fat. So again, I don't want to judge anyone. If you're doing the ketogenic, you're convinced you're getting results, you have my support. But there is no studies I can endorse at this time. All right, any questions or thoughts? All right, so now we're going to move on to clinical intervention. All right, so number one, vitamin D3. How many persons take vitamin D3?
Yes.
Okay, excellent. All right, so vitamin D3, otherwise known as nature's sunlight, right? Here we have a study of about 50 African American and Caucasian men with low-risk prostate cancer. It took 4,000 units. How many? 4,000 units for 1 year. Basically, they were compared to 19 men who was a control group, so they did not take any vitamin D. According to the results, get ready for this, there was a 55% fewer cancerous cores in their biopsy tissue or improved Gleason score after 1 year. Basically, by supplementing with 4,000 units of vitamin D, after 1 year, there was an improvement in their Gleason score. And also, there were fewer cancerous cores in their biopsy tissue just by doing vitamin D. In fact, their baseline, their vitamin D level at the start of the study was around 33 nanograms. At the end of the study, it was 66.2 nanograms, okay? And again, life extension, we have an optimal range for vitamin D. You want to see your vitamin D between 50 to 80 nanograms per ml. So vitamin D literally reversed the Gleason score and made the Gleason score something more amicable, or a better Gleason score. So it was less aggressive. And it also reduced the number of positive cores. So if you started out with a study with 5 positive cores, your cores could have reduced to 3. And we know vitamin D supports the immune system. We know that vitamin D is not a vitamin, by the way. Vitamin D is a hormone. It's actually a hormone. And hormone talks to your DNA. What vitamin D does, it promotes something called differentiation. That simply means it helps to restore cancer cells to normal cells. So again, I'm flabbergasted when certain institutions like the Institute of Medicine recommends that every adult should be taking 600 units of vitamin D per day. That's what they're recommending. But clearly, according to this study, for you to get some clinical benefit, I would suggest anywhere between 3,000 to 8,000 units per day. Personally, I take 10,000 units of vitamin D, but I'm a big guy. I'm over 200 pounds. So everyone varies. Any questions on the vitamin D?
Yeah.
Yes. Yeah. Can you OD, like, eat too much vitamin D or fat soluble vitamins? Can you have too much vitamin D?
Excellent question, and the answer to that is yes. Too much vitamin D can basically pull calcium to the heart. So they found, according to one study, where if your vitamin D exceed 100, that can potentially cause irregular heartbeat. Okay, and remember, vitamin D can increase your calcium in your blood level. So it can cause hypercalcemia, and all that calcium can go directly to the heart. So yes, sir. Everything in life is about balance, right? Night and day, male and female, it's all about balance. And again, that's why we're suggesting 50 to 80 nanograms per ml. You should be testing your vitamin D at least every 6 months to see where you are. The irony of the situation, though, in ideal conditions, your body can make up to 10,000 units of vitamin D in 30 minutes of sunlight exposure. Again, in ideal conditions. But yes, it can be toxic if it exceeds 100 nanograms.
I'm sorry. Did you say you take 10,000 IUs?
Yes.
Yes.
Wow.
Could I ask two questions? I go on vitamin trips where I'm in the sunshine for 8, 10, 12 hours a day, but I also take vitamin D supplement. During that week that I'm exposed to more than an average amount of sun, should I reduce my supplementation or can the body absorb it all?
Absolutely, yes, you should. But the irony of the situation, I'm in Florida. Obviously, sunlight all year round. And I believe over 60%, Life Extension did a study, over 60% of our customer base was deficient in vitamin D, even with adequate vitamin D exposure. But generally, yes, you want to make some adjustment based upon the season, based upon the weather patterns. You are correct.
And
I'm sorry, go ahead.
My other question was, when I first heard of this a few years ago, I asked somebody, well, IU, how many milligrams is that? And they said, well, IU is a measure of effectiveness, and it depends what your source of vitamin D, or in this case D3 is. What are the proper sources of vitamin D to get that number of IU, the 4,000 IU?
All right, great question. So most of the vitamin D, if not all vitamin D, is derived from what's called lanolin, and that's found in sheep's wool. All right, so again, it's basically derived from sheep's wool. Most vitamin D3. There are few exceptions. There is a company, I think they're called Country Life. I think that vitamin D3 is derived from a fungus, which is plant-based. That's the only plant-based vitamin D I'm aware of. But 99.9% of all the vitamin D3 is derived from sheep skin, pretty much. And it's pretty bioavailable. Remember, D3 is preferred over D2. If you take D2, your body needs to process it and convert it to D3. That's more work, right? We're looking to be more efficient, so preferably D3. Okay. Any other thoughts, questions?
Comment. When I was diagnosed 4.5 years ago, my vitamin D level was 29, and I've gradually ratcheted up my vitamin D intake. I take 9,000 units a day, and I've gone 29 to 59.
There you go. Exactly. So again, I think one of the members were a bit surprised when I said 10,000. Again, it's not necessarily the dosage. I'm basing it on my blood test. And case in point, he's taking 9,000, maybe increased in the 50s. Just keep in mind, vitamin D is really underutilized. It helps with blood pressure. It helps with blood sugar. We should be all supplemented. I think that's a take-home message. Let's move on to CoQ10. We know CoQ10, right? CoQ10 is what they call, it supports your mitochondria. We know your mitochondria are the what? The power plants of your cells, right? They're responsible for making energy. Obviously, as we age, we lose our CoQ10 reserves, right? That's why our heart gets weaker, our muscles get weaker. We know that certain medications can deplete CoQ10, right? So if you're taking a statin, you know, those drugs for cholesterol, you're wiping out your CoQ10 reserves. If you take a beta blocker, all right, beta blocker is used for what? Blood pressure, right? Slow down the heart. That can also wipe out CoQ10. According to this study, 504 healthy men, again, these men did not have prostate cancer, but I still wanted to share this with you. They had a PSA of 2.5. They took 400 milligrams of CoQ10, 400 milligrams per day, versus a placebo group, and this was done for 12 weeks, right? The CoQ10 therapy significantly reduced PSA by 33%. Again, remember, CoQ10 supports your energy level. It supports ATP, but CoQ10 supports your antibodies. And your antibodies are a part of your immune system. So again, I would encourage you to supplement with anywhere between 200 to 400 milligrams of CoQ10. Again, if you're doing CoQ10, I would encourage you to do so with food so you can get better absorption. Any questions on CoQ10? All right, let's move on to saw palmetto. We know saw palmetto is used for BPH, enlarged prostate. So some men might be having urinary issues, and by taking saw palmetto, that may help with your urinary flow. There is no studies. I'm not aware of any anti-cancer studies with saw palmetto. So again, no studies with prostate cancer. However, saw palmetto can reduce DHT by 32%. And remember, DHT is what? Dihydrotestosterone, right? And DHT can increase PSA. And remember, as PSA increase, man, what happens? It can increase cancer metastasis. So I would encourage you, if you're dealing with prostate cancer, I would suggest 320 milligrams of saw palmetto daily, not only for symptomatic relief, but to control your DHT level. Any questions on saw palmetto before we talk about lycopene? All right, so let's talk about lycopene. Now, lycopene is a powerful carotenoid, right? You can find lycopene from what fruit? Thank you. It's right there before you, right? And you can also find it in watermelons, right? Now, do you get lycopene when your tomatoes are cooked or raw? Anyone can answer? Okay, can anyone tell me why?
It releases the lycopene.
Thank you very much. So lycopene is oil-based. When you're cooking, you generally use what? Oil. So basically, that's an effective way of extracting that lycopene. So for example, the Harvard School of Public Health found that increased dietary intake of lycopene is associated with a decreased risk of prostate cancer. High intakes of tomato or tomato-based products was associated with a 20% decrease in prostate cancer. And what lycopene does is pretty impressive. Lycopene inhibits angiogenesis. And we know angiogenesis is not our best friend if you're dealing with cancer. Angiogenesis means cancer cells will produce their own blood supply. And if they do so, they're siphoning your blood supply to feed themselves. So lycopene inhibits that process. So you're disrupting the blood flow to cancer cells. If you're doing it for prevention, I would suggest 15 to 30 milligrams per day. If you're doing it for any existing prostate cancer as a treatment, you want to aim for 45 milligrams per day. Again, lycopene should be taken with a food that contains what? Fat. All right? Better absorption. Very important. Also, let's talk about curcumin. Everyone knows curcumin, right? Curcumin is the second most studied botanical extract in the world. Number one is green tea, by the way. All right? Curcumin is behind green tea. So, funny enough, there is no human studies. I could not find any human studies with curcumin with prostate cancers. Most of the studies I found were animal studies, and they were cell cultures. Now, one thing I like about curcumin is described as a pleiotropic herb. Let me repeat that one more time. It's a pleiotropic herb. And what that simply means, curcumin can work on various pathways. So it works on multiple pathways to basically affect cancer growth. For example, it also targets angiogenesis. Now remember, what's angiogenesis? Can anyone just answer, please?
Blood supply.
Thank you very much. And it also reduces metastasis. So this one herb is targeting inflammation, it's targeting the blood vessels, and it also reduces the likelihood of those cancer cells breaking loose and spreading to different parts of the body. If you're doing curcumin, remember there are different types of curcumin out there. You have a lot of choices. Life Extension endorse a special type, and that type is called BCM95. So that's Boy, Charles, Mary, 95. And the typical dose range from 800 to 1200 milligrams per day. Keep in mind though, curcumin should be taken with food. Some people, curcumin may cause what? Upset stomach, right? It's a spice, so always with the meat. Now we're going to move on to pomegranate. All right, highly regarded by the ancient Egyptians, right? It's known as a symbol of prosperity and ambition. And if you aspire to control your PSA, men, I would encourage you to invest in pomegranate. Now, personally, pomegranate is very good for supporting estrogen. It actually helps to reduce your estrogen load, so that you're aware of that. Pomegranate also helps to reduce pesticides. Pretty impressive, right? So all that pesticides you're getting in your food, your vegetables, your fruits, pomegranate helps to reduce and detoxify. Now, in regards to this study, 92 men with low-grade prostate cancer, it took 1 gram, 1,000 milligrams of pomegranate extract. Before the study, their PSA were doubling every 12 months. And by the way, if your PSA is doubling every 12 months, that's pretty good. That means that your cancer is slow growing, right? If your PSA is doubling every 6 months, that's a red flag. You're dealing with a highly aggressive cancer. and you need to start some intervention immediately. But anyway, after 6 months of taking the pomegranate, your PSA doubling time increased from 12 to 19 months. So what does this mean? It simply means that the rise of the PSA basically slowed down with the intervention of pomegranate extract. Again, 1,000 milligrams per day. Here at Life Extension, we suggest anywhere between 400 to 1,200 milligrams. For some of you who don't like taking pills, and that's fine, that's okay, nothing is wrong with that. You can do the juice, and you want to do anywhere between 4 to 8 ounces per day. I just want to warn you though, some of these juices are loaded with what? Sugar. Thank you. So, you know, I honestly prefer the capsules, especially for me. My dad is diabetic. I'm at an increased risk for being diabetic. I'm going to do the capsules, but again, that's me. Any questions on pomegranate?
Yes.
Okay. Here is. Okay, I guess no questions. All right, I just wanted to share with you this slide. This slide is basically comparing a cross section of a pomegranate to a prostate. What do you notice?
Upside down.
Image.
I'm sorry?
Looks like the inverted image of the
Oh, there you go. Yes, and this is what they call doctrine of signatures. This basically means when a fruit resembles a body part, it's usually beneficial for that body part. I just wanted to share that with you. Pretty impressive. Now we're going to talk about broccoli. Obviously, men, we know why we use broccoli, right? Broccoli helps to clear the body of excess estrogen. Is that correct? Yes. But they also did a study. One group did 400 grams of broccoli, right? Another group did 400 grams of peas. And 400 grams is equivalent to 2 to 3 cups of broccoli, all right? They did so for 12 months with a normal diet. So the only change was either the broccoli or the peas. Basically, samples of their gland, their prostate gland was taken at the start of the trial, at the 6 months and 12 months. The group that did the broccoli, basically they saw significant changes in gene expression. They did not see such change with a pea diet. So what exactly does gene expression mean? It simply means broccoli turned on certain protective genes and turned off oncogenic genes. An oncogenic gene simply means it's cancer-promoting genes. So again, if you're going to do a capsule, I would suggest 400 milligrams of broccoli per day. All right, let's move on to modified citrus pectin. Anyone knows modified citrus pectin, by the way?
Yes.
Okay, so modified citrus pectin is pectin derived from citrus fruits, oranges, lime, grapefruit. As we know, we don't necessarily absorb pectin from fruits, right? Because it's insoluble fiber. However, modified citrus pectin goes through several processes where your body can absorb it into your bloodstream. Here we have a very small study, all right, 10 men with biochemical recurrence. So that means that their cancer came back after treatment, okay, right? They took 15 grams per day for 12 months, so for 1 year, okay? Their PSA doubling time increased in 80% of the men after taking modified citrus pectin. So let me repeat. By taking the citrus pectin, 8 out of the 10 men had an increase in their PSA doubling time. Now, remember, an increase in PSA doubling time, is it a good thing or is it a bad thing?
It's a good thing.
That's great, exactly. So whereas your PSA would double in 3 months, Your PSA is doubling every 8 months. So that's actually great. Again, the suggested dose is 15 grams per day. I use modified citrospectin, but I use it for detox purposes. It's very effective in reducing mercury, very effective in reducing arsenic. You know, chicken is filled with arsenic, right? A lot of chicken is filled with arsenic, and rice as well. It's very effective in reducing cadmium. If you're a former smoker, very effective in reducing that heavy metal load. If you're curious about the mechanism, if you look on cancer cells have something called galactin proteins on the surface of their cells. So you see those red dots? Those are galactin proteins. Galactin proteins are very sticky. They are very adhesive. So they will stick to surrounding tissues and they will start to grow. The way modified citrospectin works, it surrounds the surface of the cancer cells and prevents adhesion. So what citrospectin does, it prevents cancer spread or cancer metastasis. So that's something very important to consider. Now we're going to talk about green tea extract. I know a lot of people drink their green tea. They do it for what? Cognition. They do it for anti-aging. It's actually very good studies with Alzheimer's as well. Okay. So again, here we have 60 men. The average age was around 45 to 75. Basically, they took 600 milligrams of green tea. Again, 600 milligrams. They were compared to a placebo group who did no green tea. So essentially, biopsies were conducted at 6 and 12 months. And this is pretty impressive. Only one individual in the treatment group, that's the group for the green tea, basically was diagnosed with prostate cancer at the end of the study compared to 9 men in the control group who developed the disease. So basically, 1 out of the 30 men who was taking green tea extract developed and later got prostate cancer, as opposed to 9 from the control group. So again, we see that green tea has chemopreventive properties. By the way, some of these men in this study had precancerous cells. So over a period of time, those precancerous cells became cancerous. But just by adding green tea extract, it reduced the likelihood. Now remember, green tea targets inflammation, and green tea also elicits cell suicide. Now remember, what's the word for cell suicide? Apoptosis. Okay, thank you, all right. We have some very well-informed individuals in the audience. Here we have a different study. This study is a 2009 study. They recruited 26 men with prostate cancer. And in this study, they were given 1,300 milligrams of green tea polyphenols. Various serum biomarkers were measured. So they looked on HGF. HGF is hepatocyte growth factor. They looked on VEGF. By the way, VEGF is responsible for angiogenesis. This is a culprit. This is a protein responsible for promoting blood flow for cancer cells. They looked on IGF. Remember, IGF is synonymous to human growth hormone, all right, insulin growth factor. They looked on IGF, BP, and PSA. They also monitored liver function to see if green tea would affect the liver. That's reasonable. According to the results, there were significant reduction in PSA and all the biomarkers that were measured, and there was no elevation of the liver enzymes. The suggested dose can range from 1,300 to 3,000 milligrams of green tea polyphenol. Now, let me just introduce this section. If you're doing green tea, it's not advisable to take it with food. It's best away from food. And the reason why green tea is rich in polyphenols, and they're easily affected by food. However, some people, when they take green tea at very high dose, it can cause nausea. So in that respect, you may want to do some food with your green tea. Reduce that. Any questions, by the way? All right, now we're going to talk about a landmark study. This study was actually featured in American Society of Clinical Oncology. By the way, this is a mainstream conventional group. All right, they were so impressed with this 4 herbal extract, they actually reported the findings at this conference. So basically 200 men with prostate cancer, average age was around 74 years old. The subjects were randomly assigned to receive a capsule containing pomegranate, green tea, turmeric, and broccoli. Yeah, that's a pretty good combination, right? Or a placebo. And they were followed for 3 to 6 months. I like that. 3 to 6 months, pretty short. The capsules were designed to be taken twice daily. So let's take a look on the placebo group. So the PSA levels rose by an average of 80% over a 6-month period. So there was pretty much a big increase in the placebo group, right? Let's take a look on a group that's supplemented with a 4 herbal extract. PSA rose by an average of only 15%. So here we're seeing that these 4 herbal extracts, they're not only stabilizing prostate cancer, but basically they're reducing the likelihood of cancer metastasis. Remember, if you can control the PSA man, you can also control the cancer, because PSA is an enzyme. Most people are not aware of that. It's actually an enzyme. Whenever you consume your food and you break down your fats and your carbs and your protein, obviously your enzymes digest your food. PSA is also an enzyme that will digest cancer cells. And as they digest various cancer cells, they promote cancer spread. It's always imperative to control that PSA. Any studies? Any questions, by the way? All right.
Yeah, I have a question.
Yeah, please.
You said the PSA, the prostate-specific antigen, devours cancer cells?
It devours the capsules that surrounds cancer cells.
So if there's a lot of it, it means there must be a lot of cancer. But also, if there's a lot of it, it sounds like it would be protected.
You're correct. So it's like it's a vicious cycle. So as you produce more prostate cancer cells, obviously you're generating more PSA. But the problem with that, remember, we're wonderfully created, sir. And your body is going to keep that cancer encapsulated. All right? Okay, you want to ensure that cancer cell is in the capsule. The problem, though, as that PSA starts to rise, it will start to digest the capsule. And if the capsule has been digested or worn out, those cells are going to break loose and enter the blood, the systemic blood level, and spread elsewhere in the body. So again, it's a vicious cycle. The PSA is an illustration of how well you're monitoring your cancer, but too much PSA will promote a more aggressive cancer. Any other questions or thoughts? All right, let's move on to soy. I usually get a lot of pushback with soy. Most men would say, hey, no, that's going to increase my estrogen level. I understand, and that's not correct, by the way, just to clarify. Soy, according to this study, is actually pretty impressive. So let's take a look on this study. So again, this is a pilot study of 41 men with prostate cancer. They were given 100 milligrams of isoflavone twice daily for 3 to 6 months. So they were averaging 200 milligrams of soy isoflavone for 3 to 6 months, right? The participants were divided in 3 groups. They were divided in active surveillance, okay? Active surveillance simply means watchful waiting, right? no treatment, okay? Local therapy was group 2. Local therapy means radiation or surgery, right? And they also had group 3, which is refractory hormone. So refractory hormone simply means that the cancer is no longer responding to testosterone. And if you're dealing with refractory prostate cancer, let's be honest, that's a more aggressive cancer, right? Here are the results. So the individuals in group 2, all right, group 2 was local therapy, right? They had radiation, they had surgery. By introducing soy, there was a stabilization of the PSA in 83% of the patients. Come on. That's actually pretty impressive. Again, getting back to what we discussed, you control the PSA, you are managing the cancer. Again, if this is something you can incorporate in your diet, I would encourage you to. Remember, we talked about that vegan study, the Ornish study. Yes, they did fruits, they did vegetables, they did minerals, they did prayer, but they also introduced soy. And clearly the studies are pretty impressive and resounding and compelling for soy. Now in group 3, remember group 3 is a more aggressive cancer. That cancer is no longer responding to testosterone. So essentially, there was a 35% stabilization in group 3. But again, even though it's lower than group 2, there's still obviously some benefit that can be resulted from soy isoflavone. If you're curious about the mechanism, soy isoflavones, according to various studies, elicit apoptosis, it limits cell proliferation, also helps to reduce metastasis. Also, further studies suggest men with the highest intake of soy had less incidence of prostate cancer. So again, the studies are pretty clear. Typically, we would suggest 200 milligrams of isoflavones per day.
Doctor?
All right. Yes, please, go ahead.
I'm confused. Group 2, local therapy, included prostatectomy. So how much of the 83% reduction is due to the fact that the prostate was removed and so PSA pretty much went to 0?
Great question. The PSA was rising in the study. Before the implementation of soy isoflavones, the rise of PSA was around 31%. With the use of the soy isoflavones, it was around 9%. So there apparently some biochemical recurrence.
If it was rising in the people that had the prostate removed?
You are correct, yeah.
Wow. So they were in trouble.
Yeah, remember, and by the way, you're making a good point. How can there be a rise if you remove the prostate? So remember, we have what's called what? Prostate stem cells. Yeah. Cancer stem cells. If you're doing surgery, there could be the possibility some cells will break loose. Remember, we talked about earlier the study with the table. We talked about the personality. We said that group 1 was passive, low grade. The recurrence was 5% after a radical prostatectomy. We showed group 5. Remember, group 5 was Gleason 9 to 10, and the recurrence rate was close to 80%. So again, even though the prostate is removed, we still have that what? Prostate cancer stem cell. And that's one of the reasons why with any cancer, you know, after 5-10 years, you know, some people, it's unfortunate, they will say the cancer came back. Unfortunately, the cancer didn't leave. You had cancer cells. You can't necessarily see them. You can't see them with a MRI. You can't see them with a CAT scan, but there are cells there. And that's why it's very important if you're dealing with cancer, you can't take breaks, right? You always have to be consistent. You always have to be vigilant. Cancer is really a wake-up call. Any other questions?
Yes, I have one.
Yes.
On the soy, it says stabilization of the PSA. What does that mean?
Yes.
I mean,
All right,
my PSA is increasing with a doubling time of 9 months, and I take this stuff. What does stabilization mean?
All right, so stabilization simply means that the PSA, and I looked into that, the PSA was rising. So there was a rise in the PSA. So the soy did not stop the rise in PSA. What it did was to slow down the rise in PSA. So remember, like I said before, the average increase was around 31%, right, without soy. With soy, it was 9. So that's what it means. So it's a slower increase in PSA rise. Does that make sense? Did that clarify?
Is it most soy GMO?
Okay, all right. I expected this question. Yes, most soy are. Just if you're doing a soy extract, just look for non-GMO soy. If you're concerned about genetically modified foods, yes, just select non-GMO soy. Most supplement companies do sell non-GMO. So if that's a concern, just do your due diligence and select a good company that offers non-GMO. Great question. All right. Any other thoughts on soy or controversies with soy? Okay. Next, we're going to talk about using medications as a treatment for prostate cancer. And these medications are your everyday medications. For example, metformin. Metformin is a drug for what? Diabetes, right? It's used for diabetics. According to the studies, metformin can potentially reduce cancer mortality. Here we have a study of around 4,000 men with prostate cancer and diabetes. The average age was 66 years old. They were followed for about 5 years, 4.64 years, right? 1,343 participants died. Of that amount, 300 died as a result of prostate cancer. And this is what the authors said. This is a conclusion of the study when they looked into the study with those who took metformin. Every additional 6-month interval of metformin use was linked to a 24% decrease in prostate cancer specific mortality, as well as a significant decrease in all-cause mortality. So essentially, the use of metformin decreased prostate cancer mortality. So essentially, the longer the men were on the drug, the better results they got. So, and the reason for that, metformin works on various pathways. Obviously, metformin lowers blood sugar. We talked about too much sugar can what? Suppress your immune system, right? That's a concern. Metformin can also target cancer stem cells. Not even chemo or radiation can kill stem cells. And metformin, it stimulates something called AMPK. AMPK is what they call the energy master switch. So essentially, AMPK can also limit cell growth. Personally, I take metformin. I'm not diabetic, but I'm doing it for anti-aging reasons because they found that diabetic men who took metformin live longer than men who did not take metformin and they were not diabetic. So after I saw that study, I was sold. And obviously because there's a family history of diabetes, it's better to be proactive, right, than reactive.
I do have a question about metformin.
Yeah.
Okay, so for a person who has normal glucose levels and who's insulin sensitive, would it still be a good idea to take it because it does reduce glucose levels, right? So if your glucose levels are below normal, would that not be good?
Excellent question, and that's why I encourage, if you have a great glucose levels, you have insulin sensitivity, always take metformin with food. That's going to basically lower the impact of hypoglycemia. Frankly, I've been doing this for 10 years. I've never seen a situation where metformin causes hypoglycemia. Never. So obviously, if someone has great blood sugar support, Would I suggest taking the recommended dose, which is 1,000 to 2,000 milligrams? Absolutely not, right? We have to use some common sense. I would consider using 500 milligrams or even 250 milligrams, but always with a meal to lower the likelihood of a hypoglycemic event. Excellent question. Keep in mind, metformin, even though it has all these wonderful benefits, has some side effects, right? And there are a couple side effects you want to be mindful of. One, it can lower your testosterone level, okay? Keep that in mind. Number two, it does cause some GI upset. So you may experience a lot of gas, constipation, bloating. If you're trying to solve that problem, I would suggest get an extend release metformin. With an extend release metformin, you get less GI issues versus immediate release metformin. And metformin can also deplete B12, right? So just make sure you're supplementing with a multivitamin that contains B12. Any questions so far?
Yeah, I do have another one. So obviously, metformin is only available by prescription, right? So I'm going to have to convince my doctor to prescribe it, but he's going to tell me that I don't have any symptoms that would warrant off-label, warrant per-label use of metformin. Are there any biosimilar, say, perhaps plant-based alternative to metformin?
Oh yeah, there are actually a few. One is called berberine. Berberine has a similar efficacy of metformin. Berberine. The typical dose is 500 to 1,000 milligrams. Also, there is a herb. It slipped my mind here. Let me see. It's called gynostemma. Gynostemma also has a similar effect to metformin. But let's be honest, even though I'm a proponent of supplement, there is not enough information and studies as we can find with metformin for reducing prostate cancer mortality and also killing cancer stem cells. So I wouldn't say they're a replacement, but there are things you can do to affect certain biochemical changes. So yes. Any other questions?
How to spell that second one?
Oh yeah. It's okay. Gynostemma. So I think it's GYNOM. GYNOSTEMMA. If you want, I can also include it in the email. All right, not a problem. So you can share it with the group. All right, any questions on metformin? It's a pretty good drug. Obviously, every drug has side effects. Keep that in mind. Here we have another study. 87 U.S. veterans, right? They were receiving androgen deprivation therapy, right, for advanced prostate cancer. So basically, they're trying to reduce their testosterone. Very, very disappointing, very sad, but that's what they do for prostate cancer. Patients receiving metformin for diabetes had an 18% decreased risk of death versus those who did not take metformin. So again, we're seeing our metformin combined with Lupron, combined with Casodex, can potentially reduce mortality as a combination drug. Also, there was an 80% decreased risk of skeletal related events. Remember, when you're taking Lupron, you're wiping out testosterone, right? You're like a car without much fuel. And if you're wiping out testosterone, you're predisposing yourself to osteoporosis. It appears that metformin reduced that. And again, 30% decreased risk of cancer-related deaths. Let's move on to aspirin. So many studies on aspirin. I found one, a pretty big study, 22,000 men. They were followed from 1982, all right, so a pretty long time. Those who took more than 381 milligrams aspirin per week had a 24% lower risk of getting lethal prostate cancer. So again, it's not going to reduce the risk of getting prostate cancer. It may reduce the risk of getting a Gleason 9 prostate cancer, or a Gleason 8, or a Gleason 10, and those Gleasons are pretty aggressive. Regular aspirin use after diagnosis was associated with a 39% lower risk of dying from prostate cancer. So if you're trying to improve your odds of surviving cancer, I would encourage you to have baby aspirin, okay? Make sure it's with food, right? We don't want any ulcers or gastritis. All right, make sure it says specially coated, right? Enteric coated. Again, aspirin is not for everyone, so if you bruise easily, I would not recommend it, right? So that's something I would consider, aspirin. And remember, aspirin basically does what? It blocks inflammation. It blocks COX-2. And cancer cells use COX-2 to what? Fuel growth. So again, if we target inflammation, then we can reduce the likelihood of advanced prostate cancer. Now we're going to talk about Avodart. Anyone knows Avodart? All right, guess not. Avodart is a drug used for enlarged prostate, BPH. Here we have a study of 302 patients. Basically, they were studied for 3 years, okay, taking Avodart. Again, the dose is 0.5 milligrams per day, and they compare them to a placebo group. Let's take a look on the results. So essentially, the cancer progression occurred in 38% of men in the Avodart group and 49% in the placebo group. So basically, Avodart reduced prostate cancer progression. Now remember, Avodart is a what? A DHT blocker. And if we can control DHT, we can do what? Lower PSA. We can lower PSA, we can basically what? Reduce cancer progression. Also, the biopsy was free of cancer in 36% of the men, as opposed to 23% in the placebo group. So just by using Avodart, you basically increase your odds of basically a relatively free biopsy, free of cancers. And obviously, they had lower cancer-related anxiety. Now, even though Avodart may reduce prostate cancer progression, one of the side effects, it may reduce sperm count. All right, okay. Also, it may also reduce your libido. A lot of men complain when they take Avodart, it does reduce their sex drive. So just keep that in mind. But it's very effective in controlling the cancer, all right? And finally, we're going to be talking about ketoconazole. Ketoconazole is basically an antifungal drug. All right, this is a drug used for fungus. And they found that at very high doses, ketoconazole can lower your testosterone level and also probably control prostate cancer. Keep in mind though, if you're doing this drug, you want to ensure that you combine it with prednisone, right? And the reason for that, ketoconazole can wipe out your adrenals. And if your adrenals are not working well, that can be life-threatening, right? So you want to ensure that you supplement with some prednisone, but according to some of the studies, they consider doing 200 milligrams 3 times per day with prednisone. Again, make sure you're also supporting your liver. Many antifungal drugs can do what? It can affect your liver enzymes. So that's something you want to keep in mind. And I think that ends our presentation.
Question. The last item, ketoconazole, would you take that with Lupron or instead of Lupron?
Okay, so basically that's instead of. No, I'm not advocating that, okay? I can't tell you what to do. You want to discuss that with your doctor. But essentially, it can lower your testosterone to castration level.
One other question. They say that Lupron eventually becomes ineffective. does it make any difference to your body if you then switch to a different hormone suppressant?
So yes, it does, because Lupron only works on one particular pathway for testosterone production, which is your testicles. But remember, testosterone is also produced by what? Your adrenals. So sometimes they will switch to a different drug. For example, they will switch to what? Zytiga, right? Zytiga is also taken with prednisone, and Zytiga wipes out all testosterone in the body. And that's one of the reasons why you need to take prednisone with Zytiga, because it also wipes out your adrenals. So yes, if Lupron fails, yes, they will do a second-line therapy to reduce testosterone level. Yes, you're correct.
All right.
Any other questions?
One quickly, could you equate the lycopene, I think it was 15 to 45 milligrams, depending, how many tablespoons or cups of tomato paste would there be?
Oh yeah, I'm so sorry. I would have to do further research there. No problem. I can do that for you, but I would have to send it to the email. Obviously, sir, a tomato paste is not going to equate to a capsule, because a capsule is standardized, right? But what I would encourage you, consume as much tomato paste as you can. Apparently, there are some benefits to tomato paste reducing prostate cancer risk. I think that's pretty clear.
Okay, Dr. Walker, I want to thank you on behalf of our group for a very interesting and very informative discussion. I just want to say one thing about Life Extension Foundation. I came across it years ago, and I know it was associated with Dr. Steve Strum, a really well-known oncologist who did a lot of work on prostate cancer. And I think Steve is retired now, but the website, and perhaps you could just mention it very briefly, Dr. Walker. I found the website to be extremely informative, the Life Extension Foundation website. There's tons of materials there about prostate cancer, and I would encourage all our members to at least check out the website.
Once again, will this presentation be available now?
Yeah, sure. Jim sent out an email. He sent out a link to this presentation to all our members. And by the way, if any of you guys have recently joined, we encourage you to go over to talk to Jim and get your web email address into his system so you can get his emails.
They also have next monthly magazine.
Right. If you can subscribe. I think Dr. Walker, you'll agree if we can subscribe to the monthly magazine, which has tons of really interesting and informative articles about general health, not just about prostate cancer. It's great stuff.
You're correct. Absolutely, yes, and it's free. But yeah, you can easily become a customer of Life Extension. Just call 1-800-226-2370. We can make you a free account, no obligation. We just basically provide information. That's what our sole purpose is. And essentially, you can be a subscriber, receive the monthly magazine. Yes, he also made a good point about if you visit our website, you can find various resources on various health topics, from prostate cancer to breast cancer. So it's really a wealth of information, and it's free.
Okay. Thank you again, Dr. Walker. Okay.
I get that magazine, that section. It really is. They cover lots. And they have references after every article with